Thank you for tuning into Westgate Pet Clinic's video about orthopedic surgery. I'm Dr. Teresa Hershey. If you're watching this video, your pet is likely going to be having an orthopedic surgery soon. This video is meant to inform you about torn cruciate ligaments, the most common type of orthopedic surgery done at Westgate Pet Clinic, and the details of your pet's surgery day. Please also watch our follow-up video, how to do passive range of motion exercises on your dog. At Westgate Pet Clinic, we have board-certified veterinary surgeons who come into our clinic to perform your pet surgery. A Westgate Pet Clinic veterinarian oversees the anesthesia and the before and after surgery care of your pet. The board-certified surgeons perform the actual surgery. Although many types of orthopedic surgeries are performed at Westgate Pet Clinic, the most common type of orthopedic surgery is repair of torn cruciate ligaments. The knee has many ligaments that help stabilize the joint. The anterior cruciate ligament is the ligament that is most commonly injured. This ligament can either tear completely, causing instability to the joint, or sometimes it will tear partially, leading to chronic pain and inflammation. Sometimes a partially torn cruciate ligament can heal on its own with rest and anti-inflammatory medications. Other times, the inflammation around the ligament makes surgically removing it the best option. The knee also has a meniscus, or pad, inside the joint. The meniscus can also tear. Meniscal tears are usually quite painful and act like a rock inside a shoe, causing chronic irritation. The surgeons always check the meniscus and often will remove all or part of the meniscus during surgery. When a pet tears their cruciate ligament or their meniscus, this causes pain and inflammation in the joint. The dog can become lame and limp, and sometimes the lameness won't go away. Dogs that have a torn cruciate ligament often can't do what they love to do, like run, play ball, and wrestle with other dogs. The goal of doing surgery is to stabilize the knee, reduce inflammation, and eliminate pain so that the dog can go back to their normal activities. There are several ways that surgeons will fix torn cruciate ligaments. For dogs that are less than 20 pounds and cats, your veterinarian may recommend a technique called an extracapsular repair. In this technique, the surgeon is essentially replacing the torn ligament with a heavy suture material to stabilize the joint. This surgery is not appropriate for big dogs because they can tear the suture material when the joint is stressed. For large dogs, we generally recommend a different type of surgery. The type of surgery we recommend is called a TPLO or TTA. TPLO stands for Tibial, Plateau, Leveling, Osteotomy, and TTA is Tibial Tuberosity Advancement. Both of these techniques achieve the same purpose of changing the angle of the tibia to stabilize the joint. The surgeon will choose which technique is best for your dog based on his bone structure. With any surgical procedure, complications can occur. Watch your pet at home for signs of pain, swelling, or decreased activity. It is important to follow your doctor's discharge instructions to help avoid complications. The most common complications that can occur are soft tissue infection and opening of the incision. Monitor the surgery site for signs of swelling, bleeding, and missing stitches. It is important to keep a cone on your pet's head at all times while the stitches are in place to prevent him or her from licking at the incision. Very rarely, other potential complications can occur, including bone infection, fracture of bone or implanted material, or severe arthritis in the joint after surgery. These complications are very rare. However, if your pet is becoming more lame after surgery, bring him or her back to the clinic for evaluation. Your pet will be undergoing general anesthesia and may also have had an epidural injection. Common complications after anesthesia include nausea, poor appetite, and vomiting. Generally, these symptoms go away within 24 hours. Severe anesthetic complications, including cardiac arrest, infection in the epidural site, paralysis from the epidural, or death, are exceedingly rare. Your pet will have to fast for 12 hours before surgery. The day of surgery, your pet will be admitted into the clinic by a certified veterinary technician. The technician will review the surgery, confirm which leg is being operated on, and set up a discharge appointment for later that day. Your pet will undergo general anesthesia, and the surgery will be performed that day. Your pet will have the surgery leg shaved and may have a shaved patch over the back if he or she received an epidural. You will receive a follow-up call after your pet has recovered from the procedure. At discharge, a technician will go over all of your home care instructions. We will review your medications, activity restrictions, and set up an appointment for suture removal in 10 to 14 days. If your pet is going home with a bandage, you will also need to set up an appointment for bandage removal 1 to 3 days after the procedure. After the surgery is done, your job as your pet's caretaker really begins. At Westgate Pet Clinic, we're here for you throughout the entire process. If you have any questions during your pet's recovery, please give us a call. Thank you for tuning in.